Okay, we're just going to go over the safety features one more time. We've talked about some of them already. Here is our laser in use sign, so again that can be on your cart. We've also made some extra ones for our clinic that we will post on the room so we know there's actually a laser session going on as opposed to a warning that this is a laser room. We talked about the infrared protective eyewear, so the glasses for the people and the Doggles for the animals, as well as a comfy cone as a backup for those animals that don't tolerate the Doggles. And sometimes even I will use the black claws that are in the glass cases here for putting over, say, a kitty's eye when I'm doing oral treatment. So that's another good use of the fiber cleaning cloth that is in there. Let's talk about how you can turn the laser off. The key in the back will turn the laser off. The emergency switch here will turn the laser off. The button on the handle will turn the laser off, and you can also press the front button here when you're in the ready mode to go back to standby. So there's several different ways to turn the laser off. Again, for me, the easiest one is just the finger switch button. The animal's moving or something's changing. If you want to pause the treatment, you can press the button on the switch. Also in the safety realm, we do have additional online training through AIMLA, and so that explains the laser physics, the laser safety, how to use the technique of the laser. So I think any advanced training sort of contributes to added safety. One of the main things that we're worried about when we do laser therapy is we have a lot of energy coming out of the end of the laser, so we just don't want the laser being held still for any period of time on the animal. It takes about 7 or 10 seconds at the hottest setting to get uncomfortably warm, so we want to keep the laser moving at 1 to 3 inches per second, and if we're in the non-contact mode, to be 1 to 3 inches away from the skin. Also, for comfort and safety, you can moisten the animal's coat. I just talked to a veterinarian that likes to moisten the coat of all the animals that he treats, so he'll sort of flatten the coat down and keep it cooler. But again, that's only really been an issue for me with the really dark coated, dark skinned animals at the highest setting in a non-contact mode. So that would be the case where you want to have the most level of precaution. And then just about doing laser in a safe location. So this is a big treatment area, not ideal, especially for short treatments it's okay. But again, within a 4 or 5 foot area, you want to have it protected. Don't be waving the wand around and aiming the beam upward. You know, sort of I always try to have the beam pointed downward when I'm not using the laser, and just do that all the time, sort of like a gun, you know, just keep it aiming down. I tell people the main concept to remember when you're using the laser is that if you can blow dry your hair safely, you can probably apply laser therapy pretty safely. So, you know, you do not hold the hair dryer on your head at one place and let your head get super hot, right? Same thing with the laser. Don't hold the laser in one spot and let it get super hot. Okay, so that's a good brief summary of the safety considerations for laser therapy, and we're going to take it. Okay, now sort of blending from safety, we're going to talk about the contraindications for laser therapy. So there's 3 strong contraindications. We don't want to aim the laser into any person's or animal's eye straight away. The lens will focus the beam onto your retina and you get a burn on your retina or coagulation of your retina. So that's why we're wearing the safety glasses for that. We can do it around the eye, and if infrared light gets into the orbit from different angles, it's not going to harm it because it's not going to come through the lens and cause that focusing phenomenon. So we want to protect the eyes of the users and of the patients at all times. We don't want to use it on cancer. The idea is if we're stimulating cells with laser therapy, we don't want to stimulate cancer cells. There's no evidence that this is going to be a problem, but we sort of think it makes sense based on how the laser works. It may be the case that that cancer cells are already going full speed and you can't accelerate them anymore. I have used it on some cancer patients, like with osteosarcoma. It makes the leg feel better and it doesn't suddenly get worse. But if we know there's cancer there, we don't want to be lasering that area. The third strong contraindication is active hemorrhaging. So if you have bleeding that you can't stop, you do not want to laser because we are causing some vasodilation, and that will theoretically make the bleeding worse. If there's little oozing, the laser will be fine. Immediately post-operatively, it's fine, but not when there's active hemorrhaging that we don't seem to be able to get under control. Also contraindicated to do testicles, ovaries, fetuses, pacemakers, over steroid injections, for fasciitis, and I think those are the main limits. And I think those are mostly based on jurisprudence. If something happens to the fetus or the ovary or the testicle, you'd have to prove a negative that the laser didn't do something, and of course that's difficult to do. So those are areas where you should use caution. I have definitely done it, like on our llama that was bitten in the testicles, and he seemed to recover and do fine from that. But again, those are considered to be contraindications for laser therapy. Okay. Okay, here we go again. So we want to talk about some general treatment principles when you're using the laser. So one thing is, again, we mentioned that earlier, we want to move about 1 to 3 inches per second when we're lasering on the tissue. We want to follow a grid-like pattern when we're on the tissue. We want to keep the probe perpendicular, so when we come around the corner, we don't want to be shooting off straight away like this. We want to follow the contour of the limb so that we're keeping the physics of the light going into the tissue the same from whatever angle that we're doing. These contact heads must be used in contact or only at a very slight distance. When they're farther away, the beam will be columnated and it'll get too hot. So contact heads are for contact, or maybe just slightly off if you're getting the animal used to having the laser therapy to begin with. The changing the heads is very easy. They spin off the end here, and you don't want to drop your glass massage ball on the floor because it will break. So maybe do it over a surface. Your tray will hold all of your massage ball hand pieces, and you can trade them out. So this is going to the large non-contact head. And treat these like camera lenses. Keep them covered so dust and hair does not get in there. If dust or hair does get in the lens, it can sort of start to smell up because it never gets a chance to cool down. The laser light is on it all the time. And you can clean these pieces with a little 4x4 and some isopropyl alcohol. Any of this can be cleaned in that manner. You cannot treat through any kind of clothing, bandage material, or casting material, okay? Because we don't know how much of that light's going to get through. It's very variable, and the physics are, not quantified for every different kind of material that you're trying to pass that light through. So skin and hair is okay, but anything else is not okay. If you're trying to treat a non-union fracture, you must cut a window in the bandage or cast to get the light through to the tissue that you're trying to treat. The other thing I like to remind people again is your hand is about 100 square centimeters. A 3x5 card, 100 square centimeters. That's an easy number to remember. So when you're seeing the doses come up on the laser, you can sort of check mentally, does that make sense for the number that they're telling me. So 100 square centimeters times 10 is 1,000, or times 4 is 400. So if you have a wound, 400 joules for that size wound. If it's half that big, then 200 joules, right? So it's a little math that you should be able to do and double check what the dose that's coming up on the laser is telling you. And I'll re-emphasize one more time that the small pieces are used for less than 6 watts, 5.9 or lower, and the large pieces are used for 6 watts or above. Now you can use these with lower power if you want to for whatever reason, but particularly say on a cat or a smaller animal when we're doing an elbow or a limb, this big contact head is a little uncomfortable. The smaller one, easier to manipulate and get around, the nooks and crannies of that anatomy. So those are the general treatment principles, and we'll take another break. Okay, here we go. So what we're going to talk about, again, general treatment principles. There's several things you can do to make sure the treatment is effective. I mentioned once treating the spinal nerve roots that are innervating the area that you're treating, keeping the probe perpendicular, treating the joint from 360 degrees around if you can, moving the limb into at least 2 different positions. We call that taking it through a range of motion, and if you can do it in more than 2 positions, that's even superior. And then following the dosage and protocols that's recommended by the machine. If you're not getting positive results after 3 treatments, you need to sort of reassess what's going on. Are you treating the right places? Are you doing all those things that I just mentioned? Or have we missed a diagnosis or created some other problem? After 6 treatments, you should see remarkable improvement. And again, if that's not the case, then you have to ask yourself what else is going on there to do that. So the laser will determine the dosage of each particular session, but it doesn't tell you how many or how often the sessions should be. So we treat 3 general categories of treatments. Post-procedure, so after every dental spay, neuter, or wound, they get 1 or 2 treatments, they don't get another treatment. That decreases self-mutilation and self-trauma, and it has the animal feeling better and healing faster, but it's not a long treatment. Acute conditions, so a bite or a scrape or a surgical wound, they get 3 to 6 treatments. Acute otitis would be another case, or acute anal sacculitis, 3 to 6 treatments. The wound is healed, they don't get treated again. So those are pretty easy and straightforward. The chronic conditions are a little trickier. They get 6 to 12 treatments, usually every other day or 3 times a week. We like to do Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. And then after they have sort of reached a plateau of treatment, they go to once a week. That's the transition period, and then once a month for maintenance. So 6 to 12 treatments, 3 times a week for 2 to 4 weeks, then once a week for a month, and then once a month. And again, that's sort of variable. Maybe every 3 weeks that you need a treatment, or maybe the dog goes duck hunting and needs 3 treatments after overdoing it one day. It's hard to say. Maybe a dog is only on laser therapy, it needs more because it's not on Rimadyl or Tramadol or something else like that. So that is sort of the overall treatment strategy that the doctors should be prescribing and adjusting based on the treatment response and the severity in the individual case. We're going to do a little sample treatment on Pippi, who's a rescue cat that had a broken leg that was amputated, and she's been with us for a little while now. So I promised to show you the comfy cone. These are really great Velcro on e-collars that you can put on. That'll protect the head during treatment. I also want to show you the Doggles, and we're going to get a shot of this because even if these don't fit perfectly, getting a picture like this for the owner is really great. And go zoom in on that and take a look at Pippi with her glasses on. So folks love to put that on their Facebook page. The other thing I'll tell you is, depending on the situation, sometimes you can put the comfy cone on backwards, but for her treatment, she's been used to having an e-collar on, so we're just going to put this on for her treatment. And then I'm going to select the settings here on the laser, so hopefully you can see these, so maybe just pull her back out of the way for a second. So I'm going to pick protocols, I'm going to pick feline, I'm going to pick next, I'm going to pick body type thin, short hair coat, medium coat color, and medium skin, because she's got sort of a mix of colors there. Then I'm going to pick the fracture setting because we transversed her bone there. And I'm going to pick about a 3 by 3 area for her. It's relatively small, and this is in inches. So this is telling me at 5.5 watts, I want to get 495 joules to this area. So that's what I'm going to do. I'm going to hit the standby button. You can see my areas all toweled off from reflective surfaces, so I'm not going to get any extra reflection. We can go ahead and lay her on her side. Okay, and once my laser beeps 5 times, I'm ready to go. So now I'm going to begin lasering. I'm going to move in a grid-like pattern. Keep my probe perpendicular. If I need to pause at any time, I can just press the stop button and stop. Start again. So if I can see the red light at any time, I'm probably not doing this exactly right because it means I'm letting the light not go into the tissue perpendicularly. So again, the 3 things a laser does: decrease pain, decrease swelling, and accelerate healing. So all those things are going to be helpful to our post-surgical patients. Yeah. She doesn't like to hold still, but the laser therapy is not bothering her at all. What you will notice is that sometimes when animals get their first laser therapy, they're still worried they're going to get a shot or an injection, a blood draw, a nail trim. And once they get used to the idea of getting the laser therapy, they usually adapt. So if my cat moves, no problem, I just turn it off and pause. She's going to be a good example. We'll let her stand up for this part. So we're actually letting her be in a different position. She's a little happier for the moment. I got 27 seconds left, so it's not a ton of time left to treat her. She's purring, seems to like this better than being held on her side. Yes, I know, Pippi. One thing to be aware of is, if you have to go to the other side, try not to aim the laser back up at yourself and into your own eyes. So if you can keep it in contact. Yeah, oh, I know. There we go. All done, and that's complete. So I can return this to the holster, press my button once, and what happens now is it asks me if I want to remember this treatment. I can hit yes, and then I'm going to enter Pippi's information so I can treat her just by going straight to the patient tracker section after this particular time. Okay? Okay, so I just want to show you the patient tracker function on the laser now too. So I'm going to go back to the home. I'm going to hit patient tracker. It's going to ask me to search, add a new patient, or go to the patient tracker settings. So I'm going to search for a patient. This is what you're going to commonly do. And I'm going to search for all my patients. I could put in a first letter here, say for P, and then search for everybody with P, and it shows me Pippi. Or I can go back here, and I can take my P away. Let's see here, backspace. And I can search for all my patients, and you'll see I've got Demo Dog, and I've got Margaret, which was a battler eagle from the Fresno Zoo, Pippi, my hospital cat, and then Rosie the boa, also from the Fresno Zoo. So all those patients are in there. I'm going to hit Pippi. It's going to ask me if I want to start a new treatment, or I can look at the new treatment view. So say if I want to repeat the treatment I just did, I can hit the treatment view. Let's see, is this the one I want to do, the fracture setting? I touch that. Area 3x3. Yeah, that is what I want to do, and then I just hit the repeat treatment, and it takes me directly to the treatment. So at that point, I can hit standby, beeps 5 times, and I'd be ready to do my treatment again. So that's how the patient tracker function works. You can either enter the patient after you've treated them or before you've treated them. What I usually recommend is when they come in, enter all their treatment information, put their treatment on there, and then that saves you a step at the end. So before the patient comes in the room, enter the patient tracker information. But if for whatever reason you forget or you get rushed, you can enter it after you do the treatment as well. Okay, that's it. Okay, here we go with a quick introduction to your Laser Liaison app and marketing program. So on the Laser Liaison app, you have basically 4 tabs that you can go into. The 5-minute consult is the fastest way to get in to show your client something quick. So you can watch the intro video, or you can go to the laser presentation. The intro video is several people talking about their experiences with laser therapy. The laser presentation is about an 18-slide presentation that explains how lasers work. If I go back, I can go to my patient photo journal, and in here you can see I can enter a new patient, I can search for a patient, or I can back up records. Let's go back to home. Client materials. In here we have a little bit more building on top of the 5-minute consult. So in the video section, there's several videos of newscast programs, anatomy, animations, just like we showed you on the screen of the CTS. Photographs in here that can show treatments, diagrams, before and afters of certain cases. So that's a pretty handy area to go to. The presentation that you saw in the 5-minute video is on here, and you'll see it takes a minute or so. Not a minute, but several seconds to load up because there's a fair number of slides on there. Once it does, I'll scroll through 14 slides. So once it's loaded, again, I can scroll through. Mostly this is just a question of exploring and understanding where things are. I hit done to get out. And then again, in the news, several more videos that you can look at here about in the news. So back, my favorite section at the home is going to be the staff materials. So in staff materials, you get an introduction to the Laser Liaison, and this is really the place to start. Guide you through the whole marketing program and the uses of the Laser Liaison. Back, resources. So here are several treatment guides and therapy protocols and videos. So I really like that section. Business is return on investment calculators. Anatomy animations, again, another way to get to those, same as what we have on the laser itself. Photographs, the same as in the client section. Web links is a pretty handy place if you want to go to training. So for Companion Clinician's Corner, Light Cure, AIMLA, and then also the pain scale link at Colorado is on that section. And then in the training section, there's a lot of in-depth training here. So we have a much longer presentation. It's on the order of 60 slides, I think, the training video and the medical animation. So I find that medical animation is really helpful, and also the training videos. There's several different aspects here. All the stuff that I'm telling you now or that you get during your installation, a lot of those can be looked up again on the iPad in this section. And then let's not forget the use of the iPad as far as taking pictures and using it as a camera. So as we showed you earlier, you can take still photographs and movies of all of your patients, record those, send them to them, you can email them. Let's go look under our photo section. So there's our kitty cat with her Doggles on. We'll try and bring it back. There's our kitty cat with Doggles, and you know, nice people like that, the dog. So again, clients really like this aspect of recording the treatment before and after. You can do wounds before and after, and then you can use this in other parts of your practice for dentistries, stuff you sutured together, so on and so forth. So take advantage of the laser liaison continued training, the clinician's corner, the AMLA training, and also your local representative. Okay, that's it.